Professor Heidi Larsen, Professor Tiki Pangestu, a kind of a guiding spirit for decades behind this movement, Professor Zulkifli Ismail, Professor Chang Yap Singh, distinguished guests, ladies and gentlemen, it's a pleasure to be here this morning. And let me first congratulate all of you for getting this group together, getting this event on, and for the launch of the Center for Infectious Disease Emergency Response yesterday, I believe. This is a significant development, which will make a difference both to Singapore, to our region, and indeed to the world. It's fitting that you launched this in the year of the snake. You know, the snake, depending on culture, may convey danger. In the Chinese zodiac, it also symbolizes wisdom, transformation, adaptability. And I think it's no accident that the medical community for centuries or indeed millennia has also used or embraced the snake as a symbol of healing, medicine. And actually, I think if you really get into the mythology as a test of veracity and truth, and a reminder that there are significant adverse consequences when you lose that adherence to truth. So the other attribute of the snake which is relevant here is as it sheds its skin, it's also a reminder of the need for resilience, for renewal, and transformation. So in a sense, all this does reflect, in fact, the state of global health and medicine today. It's been 5 years since COVID-19 was declared a pandemic, and it's painful that the world still remains mired in polycrisis. In fact, the theme of your conference. Conflicts in the Middle East, in Ukraine, Africa remain or continue unabated, and there's still too much of an unnecessary and painful loss of lives. And it's not just the immediate conflict, but the consequential collapse of medical supply chains, damaged infrastructure, the displaced, and indeed injuries and deaths to healthcare workers in these conflict zones, which complicate the situation even further. And of course, we're also aware that climate change is also going to exacerbate the existing health crisis and indeed create new ones. 2024 was supposed to be the warmest year on record, and you don't need to be a doctor or a scientist to know that that will also mean speeding up the evolution of microbial resistance. It'll expand the zone of threat posed by emerging disease vectors. Dengue fever is no longer just a tropical disease. It's expanding into temperate regions. And even in places like Southeast Asia, in Brazil, Colombia, the Aedes mosquito expands its geographical range. And the loss of habitat and the closer and more intensive interaction between humans and animals also will act as another accelerator for the development of new and exotic zoonotic diseases. In addition to the dangers posed by infections and vectors, we also live in the age of misinformation, another pandemic in its own right. And we witness the proliferation of medical quackery and the rise of anti-vaxxers. Let me state at this point that since the age of enlightenment, age of science and reason, healthy skepticism based on data, based on evidence, has been an integral part of medical and scientific progress. But when the cynical, almost superstitious approach that some anti-vaxxers take, which prey on the fears of people who know less than them. That's downright dangerous and immoral. And I think in this room, I don't need to make the argument. We have seen the impact of that, even during COVID-19. So at a time like this, it becomes even more important that we coordinate our efforts, not just in the clinical science, not just in immunization, but also in the way we approach science, the delivery of healthcare, and the sharing of data. Now, we have obviously, in the last few weeks and months, additional challenges. Funding for global health security is now more unpredictable, and it will have to depend more and more on discretionary and national approaches, even as we potentially hobble global ability to respond, especially given the recent pullout from the WHO of at least 2 countries that I know of. And we all know the negotiations on the pandemic treaty remain deadlocked, and there is clearly a lack of trust and political will, and I don't think that any breakthrough is imminent. All this should be a cause for concern for all of us, because without strong and effective multilateralism in healthcare, we are going to have a world which is vulnerable and ill-equipped to tackle the next healthcare crisis. And the next healthcare crisis is inevitable. And what is most painful is not just an emerging pandemic, but the unnecessary loss of lives because we didn't do what needed to be done, both in terms of prevention and action when the crisis actually emerges. So then the question that confronts all of us in this room is, so what are we going to do about it? Both from the point of view of Singapore, Southeast Asia, and indeed in the world. I basically have 3 points to make. First, we still do need to reaffirm the need for a functioning multilateral global health system. And perhaps because Singapore is such a small state, and because all vectors will eventually transit Singapore quite rapidly, as we've seen, both during SARS and during COVID-19. Perhaps because of our own vulnerability, Singapore clearly understands the importance of multilateral cooperation. So it's not just a form of words for us. To us, it is obvious, blindingly obvious. And that's why we always extend our staunch support for the WHO. And in fact, Singapore was one of the first countries globally, and I think perhaps even the first in Asia, to contribute to the WHO's inaugural investment round for 2025 to 2028. I think we made a $24 million contribution in the first instance. And this will go towards building domestic capacity to prepare for, to prevent, and to respond to healthcare crises and emergencies, especially in developing countries. And Singapore is not alone in making these contributions. The UK, Germany, Japan, Australia, and others have also made significant contributions to WHO, to Gavi, and to the Global Fund to Fight AIDS, amongst other key global health organizations. Vaccine equity must be a key priority for all of us. And in fact, if you were to take an unvarnished assessment of our response as a world in the last 5 years, truth is, we have fallen short. And if you go back earlier to the 2009 H1N1 pandemic, low and middle income economies struggled to access vaccine doses. Indeed, in fact, it often only became available after the crisis had largely subsided. Even though these same vulnerable countries were often the first in readily sharing their data samples and their pathogen samples. I'm also reminded of Ebola vaccine. And in fact, I was just informed that Heidi is married to Peter Piot, who played a key role also in helping to discover the Ebola virus. When I looked it up, he made that discovery in 1976. That's 49 years ago. And really, there wasn't any breakthroughs in Ebola vaccine development until perhaps after the devastating 2014 to 16 epidemic in West Africa, which then led to a scramble for investment and development. And yet, even after the approval of the vaccine in 2019, I think you all know, vaccine distribution for Ebola still remains limited for a variety of reasons. So clearly, even in this day and age, the paradigm does not work. And yet, the ironic thing is that viruses are not bound by ideology or political borders or attitudes. So anyway, when COVID-19 hit us, perhaps also due to the fact that we have a technocratic and scientific cabinet consisting of engineers, doctors, and people who understand evidence and data, and also informed by our experience in 2003 during SARS. When the COVID-19 pandemic hit, we were an early champion, advocate. And my then Prime Minister, Lee Hsien Loong, coined the term vaccine multilateralism. And he used this term when he spoke in June 2020 at the Global Vaccine Summit. And I'm very glad that Switzerland and Singapore worked together to found and to co-chair the Friends of the COVID Facility Group. And this was a positive global initiative co-led by Gavi and by WHO and others in order to promote equitable access to COVID-19 vaccines. And this is not a political posture. This is simply responding to the brutal reality that a threat anywhere to a human being anywhere in this globe is a threat to all of us. And those of us who can do more should do more. The Gavi COVAX Advanced Market Commitment also received over $12 billion in donor funding. Obviously, most of this would have come from middle and high-income countries, and fortunately from a variety of philanthropic organizations throughout the world. Thanks to these donors, 92 low-income countries were eligible to receive over 1 billion free doses of COVID-19. A good achievement, but again, if you think through the fact that in fact COVID-19 was not the worst pandemic which has befallen the world, and there may be far worse waiting, even this level of performance would be inadequate. So that's first point, the need for multilateralism. The second point is the need for all of us, and especially those of you in this room, to help restore confidence and trust in science and evidence-based collaboration in order to optimize health outcomes, which means it's not about convincing the people in this room, but the people outside this room. During the COVID-19 pandemic, we had the global initiative on sharing all influenza data. We call it GIZ8 for short. Right? I'm not sure what acronym you use, but that's what we called it in cabinet anyway, GIZ8. This was a platform to accelerate global understanding of the virus as it spread and mutated. Researchers in over 170 countries worked together to make GIZ8 the world's largest database of COVID-19 sequences. And thanks to both the hard work and the academic generosity of these researchers, The genetic sequence of the Omicron variant of COVID-19 was quickly uploaded when it was first detected in South Africa, allowing it to be identified in other regions, including Botswana and Hong Kong, in the very early phase of its emergence. At a time of confusion and panic, GIS-8 provided greater clarity and coordination. That's why Singapore's Agency for Science, Technology and Research has played a major role in setting up and in maintaining GIS-8 by performing high-quality checks on genome sequences submitted and classifying them. And as a science and technology hub, I can give you the assurance that Singapore will continue to support GIS-8 and efforts like this. My third point is on domestic resilience. Our domestic healthcare systems and our infrastructure form the bedrock of our response to health crisis. In Singapore, we have always emphasized the need for training and, I should add, retaining healthcare professionals in our national systems. Our intakes to our local medical schools have increased by 30% in the past 10 years. We offer grants and training awards in order to attract Singaporeans who have graduated from overseas medical universities to come back home and to contribute to our local public healthcare system. We also launched the Award for Nurses' Grace, Excellence and Loyalty. We call this the ANGEL scheme. This was launched in September last year. And under this scheme, 29,000 nurses will receive up to 100,000 Singapore dollars each in payouts over a 20-year period. It's basically a retention bonus. And just 2 weeks ago, the Minister for Health, Mr. Ong Ye Kung, announced another 37,000 public healthcare workers can expect salary increases this year. At the same time, we've also strengthened our disease surveillance systems. And we've established a communicable disease agency this year to consolidate public health functions, including genomic and wastewater testing, as well as the use and emerging use of predictive AI to ensure that any emerging waves are detected early. And our robust surveillance system can and must act as an early warning system of new outbreaks. And if we can do so, and if we can replicate these systems in our region and beyond, it in fact strengthens the preparedness and the ability to respond of our region and indeed for the world. So let me conclude by reminding all of us again that the next global health crisis is not a matter of if, but when. And we must be prepared to respond swiftly, effectively, in a collaborative way, in a scientific way, based on data and science at a global level. And for that to happen, we need conferences like this. We need the spirit encapsulated by this room, and we need this to be disseminated outside. In a sense, you need your own pandemic of science and cooperation. So let me thank all of you for coming together, for establishing this, and for those of you who traveled a long way to come here, a warm welcome to Singapore. Thank you all very much.